affected nito sa bawat organs po ng katawan natin. Kasi kung inyo pong makikita dito sa picture natin,
Mga kaibigan, bago po tayo magpatuloy, pakipindot lang po ng ating subscribe button at ang ating notification bell. Maraming salamat po and God bless.
good oral hygiene. Oral hygiene po ay especially yung sa mouth po natin, hindi lang po siya simpleng like pagtututbrush ang gagawin natin. Kasi sa ngipin po, marami pong maaring maging affected nito sa bawat organs po ng katawan natin. Kasi kung inyo pong makikita dito sa picture natin, ang katawan pong human body po ay interconnected sa bawat po parte ng katawan. So it can affect, in just a simple tooth decay, pwede pong maapektuhan ang ating puso at pwede din pong maapektuhan ang ating brain, which is pag nag-anak, pwede kang magkaroon ng dementia, yung memory loss. Heart naman, pwede kang magkaroon ng heart disease. Tapos respiratory infection, yung pneumonia. Tapos pwede ka rin pong magkaroon ng diabetes. At saka pwede ka rin pong magkaroon ng pregnancy complications, infertility, dysfunction, at saka cancer po. Yung cancer po, it could be kidney cancer or blood cancer like leukemia. Tapos pwede po tayong magkaroon ng kidney disease at rheuma. So ano po ba ang normal na itsura ng tooth? Yung number 1 po na picture na nakikita nyo, yan po dapat ang normal na itsura ng ngipin. At yung pink na yon, yan yung gums. So nakita nyo yung gums sa ilalim ng ngipin, pinkish siya. Pero yung number 2, number 3, number 4, napansin nyo po yung gums niya is swollen. Yung condition na yan, pag nagkaroon ng swollen ng gums, ang condition ng sakit na yan is gingivitis. Wag po kayong matakot kasi pag gingivitis po, it's treatable. Yung number 2 po na picture, nakita nyo po na may plaque, yung yellow part ng picture. So, yun po yung mga kinakain natin na hindi po tayo nagtututbrush, so nag-i-stay siya, dumidikit siya sa side ng ngipin natin. So yan po, pag tumigas na yan, nagiging tartar na siya. Tapos yung number 3 po, nakita niyo po yung mga pagkain na kinakain natin nagto-turn into acid, it can destroy the enamel, yung outer covering po ng ngipin natin. Tapos yung number 4 po, siya na po yung nakita niyo po sa ibabaw may cavities. Ang cavities po pwede siyang pumunta sa taas ng ngipin, sa ibabaw ng ngipin, pwedeng sa side, pwede rin pong doon sa root ng ngipin. Yan po ang mangyayari. Ito po yung normal healthy gum. Yan. May mga katabi po ba kayo dyan? Check each other. I did it for my husband last night. So, can I check your gums? You know, yung gums po sa right side, yan po yung healthy gum. Nakita niyo po pink. Tapos yung sa right side po, nakita niyo po yung gums niya is swollen and red. So that's unhealthy gum. So pag nagkaroon ng ng reddish and swollen gums, ang tawag po doon ay gingivitis, which is treatable. Ito po yung mga itsura ng mga ngipin. So, yung A po, gingivitis. Nakita niyo po yung gums nagiging red na siya. Tapos yung B naman, it's periodontitis. Yung ngipin niya nagkaroon na. Nakita niyo po sa may root banda, nagkaroon na ng gums recession. It means yung gums po medyo bumababa na. Tapos yung roots ng teeth niya nagsho-show na, tapos meron ng mga cavities. So ang tawag diyan ng okay, wait. Ang A po treatable, pero yung B, is that treatable? So once na yung gums mo ay nagkaroon na po ng recession, hindi na siya pwedeng ibalik pa. So yung gums, Pag medyo bumaba na, hindi na siya pwedeng bumalik. Unless you have to undergo surgery. So yung sinasabi nilang gums grafting, which is very expensive. Tapos yung C naman po, nakita nyo po in between the tooth, merong abscess. Tapos yung D, yun na nga po, gingivitis. Tapos yung katabi ng D niya is periodontitis. Yan yung periodontitis. If you reach this stage, which is B and D on the right side, wala na pong, hindi na po babalik sa dati yung ngipin mo. Then you have to undergo a lot of treatment. Tapos yung E po is gingivitis din po. Sabi nga po, prevention is better than cure. So, how can we prevent na magkaroon ng problems sa gums, gingivitis and periodontitis? So, we have to make a habit po na brushing the teeth and gums for 2 to 3 minutes at least twice a day. When we say brushing teeth, we have to brush our teeth properly po. So may mga, mamaya po at the end, may pagpakita po akong short video, like 1 minute, how to properly brush your teeth. And I mean, when I say
Sir, guys, sa labas.
2 to 3 minutes po yung pagtutoothbrush, kung maaari po mag-timer po kayo para talagang 2 to 3 minutes yung pagtutoothbrush nyo, and at least twice a day. Well, it means, how about if I brush 3 times a day? That's good. For example, if you eat 3 times a day, then you have to brush 3 times a day. If you eat twice a day, then you have to brush twice a day. Yan lang po yun. And then you have to floss the teeth daily. So mamaya po may pakikita akong video kung ano po yung proper flossing of your teeth. Use toothpaste and mouthwash products that contain fluoride. Yung mga Listerine, yun, pwede po yun. Maganda po yun siya. It can kills bacteria. Tapos meron din po siyang fluoride treatment. Para po, yung fluoride po, nakakatulong po yan sa ngipin para maging strong yung ngipin. Tapos yung gums, maging healthy po siya. Tapos yung bacteria mawala sa ngipin because we have so much bacteria in our mouth. Limit din po natin yung pagkain natin ng mga matatamis na pagkain like soft drinks is really bad because very high in sugar. And also like yung mga cakes, yon hindi po. Tsaka candy is terrible. Chewing gum is terrible. So wag po tayo if in case you wanna eat sweet food and you have a sweet tooth, then just make sure that you brush your teeth. Or if you're at work, then you don't have to brush. At least bring some Listerine at your work, tapos mag-rinse ka ng at least 1 minute just to remove the sweetness po sa mouth natin. Kasi kapag may matamis po, yung bacteria po, they grow sa mouth natin. So, yun po ang ipoprevent natin. Then we have to eat well-balanced diet po, which is yung mga vegetables is good, food high in calcium kasi calcium can strengthen our bones and ngipin po natin is also a bone. So, and also we need vitamin C and everything because it increase our immune system. Take supplements that will boost your dental health. Ito po yung mga, calcium vitamin supplements. Yun, pwede po natin yan i-take. If it's okay with you, kasi may mga sakit na hindi sila pwede sa vitamin D or calcium. So avoid smoking and cigarettes or chewing tobacco products. And we have to do regular dental visit po. Yung question po, ilang beses po ba tayo pwedeng bumisita sa dentist? Bibisita lang ba tayo sa dentist if we feel na mayroong masakit sa ngipin natin? Kailangan po tayong bumisita sa dentist natin at least twice a year, every 6 months. Kung hindi po kaya ng every 6 months, at least once a year. Kasi kahit po tayo nagtutoothbrush, may mga part na hindi kayang tanggalin ng toothbrush, especially kung medyo lazy tayo mag-toothbrush, then yung mga tartar and yung mga plaque nagstay there and it's really hard to remove by toothbrushing. So, ang dentist po, kaya nilang tanggalin yun. Ito po ay yung mga different kinds of toothbrush. Okay, question. ano bang toothbrush ang pwede natin gamitin? Is it manual toothbrush or electric toothbrush? Any kind of toothbrush works po. Pero if you can afford to buy electric toothbrush, it's really good because yung electric toothbrush po, umiikot siya ng maraming beses. Compare sa manual toothbrush na, you know, how many seconds per minute lang yung kaya niyang i-ganon sa ngipin mo. So electric toothbrush is good, but if manual toothbrush is also good as long as you regularly brush your teeth. Tapos sa right side po, ito naman po yung floss. There are different kinds of floss. Actually, ito lang yung meron sa bahay. So pinicturean ko. So meron po siyang bubuksan mo yan siya parang cartridge, and then meron siyang parang a string. Tapos puputulin mo siya, tapos ilalagay mo siya in between your tooth. Kasi pag nag-toothbrush po tayo, meron pong mga particles na hindi kayang tanggalin ng toothbrush. And you need to use floss para po yung in between ng mga gums natin and between teeth, matanggal po yung mga debris na mga kinakain natin. Kasi pag nag-stay po yun, dun po nag-harden. And then pag nag-harden yung mga tartar, yung mga plaque, and also yung mga food can, di ba po, if there is a debris or sweet stuff sa ating mouth, bacteria will multiply. Then it can destroy our gums and our teeth din po. May video po ako dito na ipapakita. Just let me know po kung meron pong boses.
To keep your mouth healthy, it's so important to brush your teeth for 2 minutes twice a day. Here's how to do it right. Place a soft bristled brush at a 45-degree angle to your gums and move the brush back and forth in short strokes. Not too hard, use gentle pressure, not hurting the gums. Brush all sides, including the chewing surfaces of all teeth. To clean the inside surface of your front teeth, tilt the brush vertically and make several up and down strokes. And finally, brush your tongue to remove bacteria and keep your breath fresh. Use a fluoride toothpaste with the ADA seal and replace your brush every 3 to 4 months. Sooner if the bristles get frayed. Brush twice a day, floss once a day, and see your dentist regularly. To learn more about taking care of your teeth and gums, visit mouthhealthy.org.
Meron pa po akong isang video.
People who floss every day are taking a significant step in keeping their teeth clean and healthy. Periodontal disease and many cavities start between the teeth, where the bristles of your brush simply can't reach. That's why flossing is necessary for removing the plaque and bacteria that cause these dental diseases. To begin, pull out 18 inches of floss and wind it around the middle fingers of each hand, leaving about 5 inches in between. Hold the floss between your thumbs and index fingers, leaving about 1 inch to work with. Gently glide the floss between the teeth using a gentle side-to-side motion. Pull the floss tightly in a C shape around the side of the tooth and slide the floss under the gum line. Move the floss up and down several times to remove all the food and bacteria. Then pull the floss around the neighboring tooth and repeat the process. Wind the floss to a fresh section and gradually work your way around your mouth, cleaning both sides of every tooth. If your gums are infected, they'll bleed when you floss, and that's to be expected if you are just beginning to floss. After a week or so of regular flossing, the bleeding should go away. If you have problems reaching some areas, you may want to use a floss fork or other flossing aids. Tell us if your teeth are too tight to floss or if it catches or tears. This indicates that there may be problems in your mouth that need to be fixed. Let us know if you have any questions about your flossing. We'll be happy to recommend the best floss for you and offer tips for keeping your teeth and gums healthy.
Meron pa pong isa, last na po to.
Now that you're done with brushing and flossing, it's time to give yourself 100% oral care by rinsing with a mouthwash. First, pour 20 ml of your mouthwash into a cup. And then, pour it into your mouth without diluting the mouthwash. Slowly rinse each portion of your mouth. Let's start with the front, keeping your lips tightly closed. Then move on to the sides, making sure the inside of your cheeks are reached as well. You must also gargle in order to reach the bacteria that settles at the back of your mouth, just at the throat. Keep a check on the time and spit the mouthwash after 30 seconds. Now, all you have to do is make sure you don't eat, drink, or smoke for 30 minutes, and you are on your way to 100% oral health.
Okay. Yan lang po. Summary po, ang isang healthy po ng ngipin ay malinis, walang sakit na nararamdaman, at walang cavities at anong sakit. At yung gums po ay dapat pink, at saka pag nagtutoothbrush po tayo, hindi po siya nagbe-bleed. O pag nagpa-floss tayo, hindi po siya nagbe-bleed. Kasi po ang oral health, kahit ngipin lang po yan, I mean, we ignore our teeth, you know. But di ba dapat po maging aware po tayo sa ngipin natin kasi we use this every day. We use our mouth every day, every second. So we eat 3 times a day, we eat snacks, and we talk to people, we smile. So ito po yung front face natin, yung ngipin natin. So we have to take care of it. And even though, ano po, hindi lang po sa physical appearance, but also yung bad breath po is also not good kasi sometimes it's so embarrassing when you have bad breath, and sometimes you just ma-realize mo na lang, oh, why my friend doesn't talk to me kasi yung pala may bad breath. So we have to take care of that because that's a start kapag may bad breath ka. It means there's a problem, so you have to go to the dentist and ask for help. He can help you. Tapos also just a simple tooth problem can lead to many diseases and even major diseases like yung kanina po na diniscuss po natin. So it's very important po na we have to take care of our mouth and our teeth. Thank you po. Keep smiling. May ngipin man o wala, we have to smile. We have to be the encourager. Don't be scared na ngumiti kung wala po tayong ngipin. Or something kasi po kailangan po natin, especially this COVID time, we need to be the encourager and maging ano po tayo sa kapwa natin. Kung hanggang dito na lang po, if